Hello, welcome to our presentation on reducing the risk of fentanyl-related overdoses based on principles of motivational interviewing, prepared by Anna Snow and Chelsea Betzold. Fentanyl was originally manufactured and Federal Drug Administration or FDA approved for use as an analgesic. It is roughly 50 to 100 times more potent than heroin, and the amount equivalent to grains of salt is harmful enough to cause death in human being. On this slide, we can see the visual comparison between heroin and fentanyl. Individuals who do not utilize harm reduction techniques when using opioids have a greater risk of experiencing an overdose, which can be fatal. Harm reduction techniques such as supervised injection facilities, Narcan administration and education, and drug checking have been exercised in multiple geographical locations across the globe. Drug checking, or the act of testing drugs, drug residue, or the individual urine before and after the use of drugs, has gained popularity among people who use drugs to decrease risk of overdose. Multiple studies indicate that fentanyl test strips drug checking prior to use of participants' drugs in the privacy of their own home was preferred. Also known as self-testing, using rapid fentanyl test strips has also been determined to be most cost-effective and the easiest of drug technologies to use, and has a high detection level for fentanyl and fentanyl analogs. The Department of Health and Human Services declared the opioid epidemic a public health emergency and focused its effort on combating the alarming statistics of overdose-related deaths. Causing further distress, fentanyl, a synthetic opioid, has caused death due to overdoses to increase even more rapidly. On this slide, we can see in general a significant increase in overdose death from years 1999 to 2019, and overdose-related death caused by synthetic opioids such as fentanyl has also spiked from 2015 and on. According to CDC, some of the United States do not have data on synthetic opioid overdoses, but some states report a significant rise in fentanyl-related overdoses and deaths. Massachusetts is one of the states that has experienced a significant rise in death related to opioid overdoses. As this slide depicts, in Massachusetts in 2017, there were 1,649 deaths related to synthetic opioid overdoses and 1,806 deaths in 2018, which shows an unfortunate increase in trend. Relapse is considered part of the process of undergoing treatment for substance use. Clients who are enrolled in Medication-Assisted Treatment (MAT) program are at increased risk of relapse due to the changes in habit-forming pathways that have been created in their brains from past use, the immediate social surroundings that can possibly condone the use of drugs, and the client potential decrease in strength to say no to the use of substances. Motivational interviewing, or MI, was initially developed within the addiction field to motivate individuals to commit to healthy, drug-free lifestyle. MI is an effective method of eliciting behavior change when it comes to complete abstinence of drugs, or on the other end of the spectrum, MI can help the patient commit to the use of fentanyl test strips if a client is making the decision to use drugs. MI recognizes that ambivalence and resistance to change are a natural part of change and growth. So what happens if clients decide to use drugs? There are multiple studies showing that clients who are enrolled in MAT program are at higher risk of death, especially if their drugs contain fentanyl. Researchers show that those who detect fentanyl prior to use may change their behavior to either not use drugs at all or reduce the amount of drugs they use. 93% of individuals in one recent study wanted to know if fentanyl was in their drugs before using, and 85% of individuals believed that drug checking with fentanyl test strips could help them to prevent an overdose. Because of stigma associated with people who use drugs, some individual studies said that they would feel uncomfortable being seen going into treatment facility to have their drugs checked. The fentanyl test strips take-home method would alleviate these barriers and would allow participants to feel more comfortable self-testing for fentanyl. In addition, Massachusetts has submitted the Good Samaritan Law, or Bill S-904, to include decriminalization of drug checking paraphernalia, and is waiting for it to be passed by a legislator. Currently, there were several studies that have been completed across the United States, such as Baltimore, Maryland, Providence, Rhode Island, and Boston, Massachusetts, where drug checking services for people who use drugs was offered, which showed that other states' interest in importance of drug checking. So how could motivational interviewing be used to help to reduce fatalities among those using drugs? MI is a highly patient-centered approach and based upon a client's readiness for change. While some clients are ready to commit to changing their behaviors and not using drugs at all, other clients are not ready for the change and may choose to use drugs if they're in a situation when it is offered to them by friends or family members, easily accessible to them in social environment. If that is the case, the clients set their own goals through the use of MI with a member of their care team, and they start to feel welcomed to talk about their struggles. MI easily fits in with other treatment modalities, such as pharmacological treatment or counseling. It increases retention and adherence to treatment. And finally, motivational interviewing offers tools of how we can talk to the clients about the use of fentanyl test strips without feeling that we are encouraging clients to use drugs. We want to make sure that clients is successful in treatment, and preventing an overdose-related death is a main component of their safety. Motivational interviewing allows the providers to determine the ability, motivation, and accountability of the client. In other words, motivational interviewing provides the ability of the provider to determine if client is ready to change, if they're motivated enough to do so, and if they have the tools on how to make the change in self-behavior, hope, and self-efficacy. By using MI, providers discover personal options for the client, as well as solutions to the current situation, while promoting autonomy and self-efficacy of the client. If a client at the stage of motivational interviewing where they have ability and motivation to change, but they did not reach the stage of accountability, at this point of treatment, it would be crucial to provide the client with resources to prevent death from overdose, as there is a possibility of the client deciding to use drugs. By offering the client fentanyl test strips, we are encouraging them to be accountable for their own actions while having the ability to make an informed decision. As you can see, the cycle of addiction is not linear. Most of the time, client starts from fantasizing about using drugs that leads to obsessing over where am I going to get the drugs, how am I going to pay for the drugs, which in turn leads to substance abuse. At the stage of substance abuse, where the individual has lost the control over their use, the client has chemical dependency on the substance they're using, as they have altered brain chemical pathways. The individuals often feel guilty about substance use, but they're not able to stop using on their own. Normally, at this stage, they're starting to get treatment for substance use disorder and go from withdrawals to getting treatment in MAT programs. And even though an individual may be in treatment program, it does not mean that they will not relapse. Relapse is considered to be part of recovery, which eventually will lead to readiness for cessation of substances. Some clients will relapse several times, but as long as they feel supported, they are able to return to cessation of use over time. During relapse, it is extremely important that clients are aware of presence of fentanyl in the drugs, so they can either significantly reduce the amount of drugs they use or not use the drugs at all, as it potentially can lead to death, especially if drugs contain fentanyl. So how do we apply motivational interviewing when talking to the client in order to provide evidence-based care? There are 8 tasks that are important to master when applying MI. First and foremost, we need to understand what encompasses the spirit of MI. The focus of MI is the mindset of being present with the client and seeing the world through their eyes. In order to achieve this, the provider needs to have a therapeutic relationship with the client where the client feels accepted. Patient-centered counseling skills that utilizes MI consist of mnemonic ORS that stands for open-ended question, affirmation, reflection, and summaries. We will cover the OR skills later in the presentation. We need to learn how to recognize change talk and sustain talk when communicating with the clients. For example, some patients are talking about making changes in their life, but they get stuck in their old ways of thinking, and it's difficult for them to continue to progress towards recovery. During this stage, they are at increased rate of relapse. To overcome this, as providers, we need to elicit and strengthen the change talk. Ambivalence and resistance are the important part of the process, and provider need to roll with the client resistance and accept the resistance to change is a normal part of the process and growth. Client, with the help of the provider, can develop a plan that helps the client to consolidate the commitment for change and attainable goals that will help the client to transition towards sobriety. This brings us to the 4 foundational steps of applying motivational interviewing. First, we should not underestimate establishing a working and trusting relationship with the client. Therapeutic relationships allow clients to feel comfortable discussing difficult topics openly, and the clients are more likely to discuss if they recently used drugs or were in a situation where they were tempted to use drugs. If one of the previous situations has occurred, but the individual did not use drugs, the client will explore with the provider what they feel helped them to make the decision of not using the drugs. When discussing the focusing in the motivational interviewing engagement process, we are talking about identifying the directions toward change for the client. Evoking is understanding that people can talk themselves in and out of change. Healthcare providers play a vital role in evoking engagement in motivational interviewing, as they can guide the client towards talking themselves into making a change. Motivational interviewing is a strength-focused approach where the provider tells the client, "You already have what you need, but together we can find it." The planning step in the process is a transition of the client deciding on why they want to change, when they want to change, as well as how the client will make these changes. We can use acronym ORS: open-ended question, affirmation, reflective listening, and summarization. The skill of asking open-ended questions requires some practice, but it allows client to not answer the question with simple yes or no answers. It gives the provider more information by allowing the client to elaborate on their answers and help providers to learn about barriers and challenges that client may be facing regarding the drug use. Affirmation is an important part of motivational interviewing, but it does not mean that we are giving client approval for their behavior. Affirmation relies on client's own personal strength, efforts, and resources. We are providing affirmation of the client capability of growth and changes they are making towards recovery. For example, even though we know that client is at high risk of using drugs, we can use affirmation to talk about the situations when they were strong enough not to use drugs, or situations when they decided to use fentanyl test strips and drugs use behavior changes to ensure that they would not die from overdose. In reflective listening, we are listening to understand and accept what client is telling us, but not listening to frame an argument. It helps to create understanding and open environment where client feels free to talk about the changes they have been making in their life and would like to make as next step. Summaries are essential reflection that collects what the client have been saying and normally is used at the end of the session. Summaries can also be used as transition from one task to another. There are overlaps among all the skills, and in conclusion, summaries is a simple and long reflection of what clients have been saying. Now we can watch a video where we go over the information we discussed about motivational interviewing. Hi Sam, my name is Anna and I'm a psychiatric nurse practitioner. Tell me a little bit more of what is going on in your life.
Yeah, my boss is on my back all the time because I'm not meeting deadlines. I get home, house is total wreck, children are screaming. Partner gets mad because I don't feel like doing work around the house after I get home. We're always broke. I just can't handle it anymore. All I want to do is do drugs to help me out with the stress. But if I use drugs, my partner gets even madder. And the kids are still screaming. It just keeps getting worse and worse. My partner lives close, but they hate it when I use drugs and they're not there for me.
So if you have help around the house, it would make things a little bit easier for you, right? It could possibly lessen some stress.
Well, who's supposed to help? I just said there's no one to help.
Maybe you could get cleaning services and childcare to help you for a little while.
Look, have you not been listening at all? I just said we are always broke. And it's not just because I'm a drug addict. Why can't you understand it?
Well, it feels like I'm on a wrong path here because I'm trying to fix it rather than trying to understand what is really going on in your life.
Yes, finally. You can't fix my life. I just don't have anyone to talk to, and it makes everything worse.
I bet you're feeling like you barely can hold your head above the water, and it has been a lot of changes in your life, like new marriage, feeling like you don't have any family support and nobody to talk to.
I just feel like my life is falling apart. I'm losing my mind. I don't have the energy. I have constant cravings. I don't know, maybe I need to get a higher dose of my medications.
It sounds like you're feeling upset and confused and maybe a little bit surprised.
I just never thought I would be feeling this way. I get so mad with my partner all the time. She's still using drugs, and when she does, I start screaming and throwing things at her.
Are you angry with your partner when she's using the drugs?
Yes, I am. My partner has no desire to stop, and it just creates too many temptations for me.
You've been really honest. So nothing like that have happened before, right?
Well, it has actually. It used to happen a lot when I would get too high, but I didn't think it would happen now as I'm off the drugs.
Do you think your anger outbursts are related to her using drugs?
I guess it could.
Remind me of the coping skills you used in the past that help you with anger and not using the drugs.
The only thing that helps me to walk away from my partner. I would get mad in the past and go visit my parents or somewhere where drugs are not so readily available to me.
Is it something that you're willing to do again?
Yes, I can do that.
So from what you have told me, you feel frustrated with your partner because she's using drugs in front of you and it creates temptations for you. You get angry with her and start throwing things, and in the past you tried to separate yourself from the situation and found it to be helpful.
Yes, it helped me before. Now come to think of it, even though I have cravings, I'm able to deal with them, deal with the situation much better when I'm not surrounded by people who are constantly offering drugs. I'm thinking it might be good for me to live with my parents for a while until things settle down.
Can you describe the situation where you might be tempted to use drugs? when you're around your partner or friends, for example?
Friends, my girlfriend, I guess. Pretty much everyone I know uses drugs.
Remind me of the harm reduction techniques you could use to prevent overdose.
Myself and my parents have Narcan, just in case. But I know sometimes street drugs could be spiked. But I have no way of knowing if they are.
We have some fentanyl test strips, and I could teach you how to use them. Would you be willing to do that or interested in it?
I definitely would, because I can check to see if the drugs are spiked for my girlfriend as well. I would be devastated if something happened to her.
Thank you, Sam. We now have better understanding of how to apply motivational interviewing when talking to the client, and we can more easily discover what drives client decision. Decisional balance look at the pros and cons of the decision that the client makes or has made. On the left side, we will look at the benefits of changing the behavior, and on the right side, we can look at the concerns that client has about making a change in behavior. When client has a lot of concerns regarding changing their behavior, it is at that point that the provider can talk to the client about different forms of harm reduction techniques, including the use of fentanyl test strips.
The origin of harm reduction started in Amsterdam in 1984. Amsterdam was the first city to recognize drug use as a disorder, and a needle exchange was opened by an organization of injection drug users. The United Kingdom, also in 1984, started to focus on reducing the harms of drug use rather than trying to reduce drug use in itself, and created the Mercy Harm Reduction Model. The United States, in 1988, in Tacoma, Washington, established the first full-service needle exchange program in response to the HIV epidemic and the use of non-sterile injection equipment. The establishment of this program increased access to needle exchange program services nationally. In 2018, Massachusetts created the Harm Reduction Commission, which is aimed at the prevention and access to appropriate care and treatment of addiction. The Commission is in charge of reviewing and recommending harm reduction strategies in order to address substance use disorder. It is comprised of the Secretary of Health and Human Services, as well as a panel of policymakers, public health professionals, legal professionals, clinicians, and local residents. In 2019, the Harm Reduction Commission stated the definition of harm reduction in substance abuse is a spectrum of strategies for safer use, to manage use, to abstinence, in order to meet drug users where they're at, and addressing conditions of use along with the use itself. It is determined that there is no universal definition or formula for implementing harm reduction, as its demands are based upon specific individual and community needs. The Harm Reduction Commission also stated, the defining features of harm reduction is the focus on the prevention of harm rather than on the prevention of drug use, and the focus on the people who continue to use drugs. The National Harm Reduction Coalition created an 8-principle guide to harm reduction. Number 1, we must accept, for better or worse, that licit and illicit drug use is a part of our world, and we must choose to work to minimize its harmful effects rather than simply ignore or condemn them. Number 2, we must understand that drug use is a complex, multifaceted phenomenon that encompasses a continuum of behaviors from severe use to total abstinence, and acknowledges that some ways of using drugs are safer than others. Number 3, we must establish the quality of individual and community life and well-being, not necessarily the cessation of all drug use, as the criteria for successful interventions and policies. Number 4, calls for the non-judgmental, non-coercive provision of services and resources to people who use drugs in the communities in which they live in order to assist them in reducing harm. Number 5, we must ensure that people who use drugs and those with a history of drug use routinely have a real voice in the creation of programs and policies designed to serve them. Number 6, affirms that the people who use drugs themselves are the primary agents of reducing the harms of their drug use, and it seeks to empower people who use drugs to share information and support each other in strategies which meet their conditions of use. Number 7, the recognition that the realities of poverty, class, racism, social isolation, past trauma, sex-based discrimination, and other social inequalities affect both people's vulnerability and the capacity for effectively dealing with drug-related harm. And number 8, the ability to not attempt to minimize or ignore the real and tragic harm and danger that can be associated with illicit drug use. The goals of harm reduction are to engage vulnerable, hard-to-reach populations, to reduce fatal overdoses, to reduce infections associated with injection drug use, to support individuals to protect their health while using what they consider treatment and recovery, to keep individuals engaged if they relapse or aren't currently abstinent from drug or alcohol, to reduce stigma associated with drug use, and lastly, to improve individual and public health. Examples of harm reduction techniques currently being used in Massachusetts are using skin alcohol wipes to prevent abscesses before injection of substances, avoiding sharing needles, syringes, water, cotton, or cookers, using syringe service programs to access sterile injection equipment, getting tested and treated for HIV, HCV, and STIs, or sexually transmitted diseases, getting vaccinated against hepatitis A and B, using test shots or injecting a small amount of a substance instead of the whole dose when injecting an unknown substance, trying not to use substances alone, trying to prevent the development of a tolerance by limiting use, having naloxone or Narcan available in order to respond to an overdose, and knowing how to seek help for yourself or friends through local programs and supports. Through the Massachusetts Department of Public Health, currently their harm reduction efforts are the Department of Public Health Syringe Services Program, or SSP, and the Department of Public Health Overdose Education and Naloxone Distribution Program, or the OEND. This table shows the Massachusetts Overdose Education and Narcan Distribution Programs as of April 2020. Through the Massachusetts Department of Public Health, Narcan or naloxone is purchased for distribution in places such as first responder and pharmacies, as well as to overdose education and Narcan distribution facilities across the state. The Department of Public Health also funds Health and Human Services organizations with access to priority populations, as well as oversees the management of data collection and reporting on substance abuse at individual OEND programs. The Massachusetts Department of Health also provides medical oversight to programs and staff of the OEND program sites. The majority of OEND programs are also syringe service programs that provide needle exchange and drug user health services. OEND programs provide overdose prevention to addiction group treatment programs, street outreach, programs at criminal justice settings, as well as others. Participants in the OEND programs receive education on overdose prevention and are encouraged to share knowledge of their social networks. The OEND training covers how to prevent and recognize an opioid overdose, the importance of immediately calling 911, how to perform rescue breathing, how to administer nasal naloxone, and the importance of staying with an individual until help arrives during an overdose, which falls under the Good Samaritan law in Massachusetts. This map in the picture on the slide shows the current Massachusetts syringe service programs as of October 2020. In Massachusetts, SSPs provide access to sterile injection equipment, proper syringe disposal services, referrals to substance use disorder treatment, HIV, HCV, or STI education and risk reduction counseling, testing for HIV, HCV, and STIs, and linkage to their primary care and case management, as well as an overdose prevention and naloxone or Narcan distribution and training. There are approximately 120 supervised injection facilities, or SIFs, currently operating in 10 countries around the globe. Countries include Canada, Australia, Denmark, France, Germany, Luxembourg, the Netherlands, Norway, Spain, and Switzerland. Over 100 evidence-based, peer-reviewed studies have consistently proven the positive impacts of supervised injection facilities, including the increasing entry into substance use disorder treatment, reducing the amount and frequency that clients use drugs, reducing public disorder and public injection while increasing public safety, reducing HIV and hepatitis C risk behavior, such as sharing needles and unsafe sex, successfully managing frequent on-site overdoses, and reducing drug-related overdose death rates. There has not been a single overdose fatality at any safe injection sites worldwide. SIFs also save costs due to the reduction in disease, overdose deaths, and the need for emergency medical services. They also increase the delivery of medical and social services to people who use drugs. There currently have been no overdose deaths reported inside the SIFs, as I've mentioned, and in July 2018, 13 sites are seeking approval within the United States to have safe injection facilities established, including in New York City, Philadelphia, Boston, San Francisco, Seattle, Denver, in Vermont, and in Delaware as well. There are reports of multiple safe injection sites currently operating in the United States by invitation only, and are still currently considered illegal. But reported overdose rates have declined in the surrounding communities. The Legislative Analysis and Public Policy Association discussed how 32 states currently have paraphernalia laws prohibiting the use of fentanyl test strips. And if the fentanyl test strips are found on a person or the individual is found using them, they are subjected to possible legal ramifications. As of May 2021, 10 states, including Massachusetts, Arizona, Delaware, Kansas, Maine, Minnesota, Nevada, New Mexico, West Virginia, and Wisconsin, have bills pending in their state legislature that would exclude fentanyl test strips from the definition of drug paraphernalia and would allow the possession and use of fentanyl test strips. Despite the 32 states having laws including fentanyl test strips as paraphernalia, there are states that have instituted the fentanyl test strips, or FTS strips, and their distribution, including California, Connecticut, New Jersey, Ohio, Texas, Utah, and Washington, among other states. The Centers for Disease Control and Prevention and the Substance Abuse and Mental Health Services Administration announced on April 7, 2021, that federal funding can now be used to purchase fentanyl test strips in the United States. Currently, Massachusetts is one of the legally prohibiting states of FTS, fentanyl test strips. However, Massachusetts has a bill pending to remove fentanyl test strips from being considered drug paraphernalia. Just because Massachusetts state testing equipment is defined as drug paraphernalia by law, it doesn't mean that harm reduction organizations are prohibiting from distributing or using these fentanyl test strips. For example, as of 2020 in Massachusetts, state law included testing equipment in its definition, but the Massachusetts Police Assisted Addiction and Recovery Initiative, PARI, initiated a 3-month pilot program where it partnered with 11 police departments across the Commonwealth to distribute fentanyl test kits to individuals who are at risk of an overdose. The pilot project received a $150,000 grant from the Massachusetts Department of Public Health itself. With fentanyl test strips being removed from drug paraphernalia laws pending in legislature in Massachusetts, it's only a matter of time before the change is made in Massachusetts law to exclude fentanyl test strips from its drug paraphernalia definition. So what are fentanyl test strips? Fentanyl testing strips were originally manufactured to test the presence of fentanyl in urine to determine if fentanyl was present in an individual's system. Fentanyl test strips are now being used for an off-label use to detect the presence of fentanyl in drug samples prior to ingestion. Fentanyl test strips are cost-effective, averaging roughly $1 per strip, and the BTNX Incorporated brand specifically is 96 to 100% accurate in detecting the presence of fentanyl in substances. The recommended method for using fentanyl test strips is to dissolve all of the substance intended to be consumed, for example, a powder or crushing a pill, in water. The test strip can then be dipped into the solution once completely dissolved and can be read after 15 seconds whether or not the test detected fentanyl in the substance. The majority of fentanyl test strips on the market currently are manufactured by the BTNX Incorporated, a Canadian biotechnology company that specializes in drug testing research and development. Centers for Human Development currently use the forensic fentanyl test kit. Fentanyl analogs, which are synthetic drugs created to mimic fentanyl, can also be detected by the BTNX forensic fentanyl test. Those analogs include carfentanil, acetylfentanyl, butyrylfentanyl, remifentanil, ocfentanil, sufentanil, p-fluorofentanyl, furanylfentanyl, valerylfentanyl, and 3-methylfentanyl. The detection limit of the BTNX forensic fentanyl test is below 200 billionths of a gram, making it highly reliable. It has been named the best and most accurate fentanyl spot test kit with over 90% accuracy. The BTNX forensic kit arrives in a box that contains 5 fentanyl test strips, 5 swabs, 5 test tubes, 5 extraction liquids, and a test tube holder, as well as instructions on the kit's use and a product insert. To test a liquid substance, take one of the clear plastic test tubes and place it upright into the plastic test tube holder. Take one of the bottles labeled buffer solution and empty the entire bottle into the test tube. Add 1 drop of the liquid substance that is being tested into the test tube filled with the buffer solution. Dip the handle end, not the cotton swab end, into the test tube solution and substance and stir for 1 to 2 minutes. Discard the swab. Take out the single test strip from its packaging, and while holding onto the dark blue end of the strip that has hands printed on it, dip the other end into the test tube of buffer solution and substance and hold it in place for 15 seconds. Make sure not to submerge a strip past the max line as shown in this picture on the slide. After the 15 seconds have gone by, remove the strip from the test tube and place it on a flat, horizontal surface. Read the results after 5 minutes, but be sure not to read the results after 10 minutes or more, as the results could be incorrect. To test a powder substance, take one of the clear plastic test tubes and place it upright into the plastic test tube holder. Take one of the bottles labeled buffer solution and empty the entire bottle into the test tube. Then take the cotton swab given and dip the cotton end into the tube of buffer solution and let it soak for roughly 3 seconds. Take the now moistened cotton swab and move it against the surface of a baggie or into an actual powder substance to pick up the substance on the swab. Dip the cotton swab end back into the test tube filled with buffer solution. With a circular motion, and you can even move the swab against the wall of the test tube, stir the swab gently for 1 to 2 minutes. Discard the swab. Take out the single test strip from its packaging, and while holding onto the dark blue end of the strip that has the hands printed on it, Dip the other end into the test tube of buffer solution and substance and hold it in place for 15 seconds. Make sure not to submerge the strip past the max line, again as shown in the picture at the bottom of the slide. After 15 seconds have gone by, remove the strip from the test tube and place it on a flat horizontal surface. Read the results after 5 minutes, but be sure not to read the results after 10 minutes or more, again, as the results could be incorrect. There must always be a red line in the control area as indicated in the picture at the bottom right of the slide. If there is no control line in the area, the test is considered invalid and will need to be performed again. With a red line in the control area only, this indicates a positive test. With a red line in the control area and a line in the test T area, or two red lines, it indicates a negative test. A negative test is indicated even if there is a faint red line in the control line also. And once again, if there are no red lines present or no red line in the control area, the test is invalid.
The Rapid Response Fentanyl Test Kit detects the presence of fentanyl in liquid and powder substances. The test kit is specific for fentanyl screening with no significant cross-reactivity to other opiates such as morphine and heroin. With over 98% accuracy, this is the best fentanyl spot test kit currently available. The test kit contains 5 fentanyl test strips, swabs, test tubes, extraction liquid, a test tube holder, instructions, and product insert. Instructions for testing surfaces, powders, and solid substances. Step 1. Place the test tube into the included test tube holder. Pour the entire bottle of buffer solution into the test tube. Step 2. Dip the included cotton swab into the test tube for 3 seconds to moisten the swab. Step 3. Wipe the wetted tip of the swab across the contaminated surface, powder, or solid substance to be examined. Step 4. Dip the swab into the filled test tube and stir for 1 to 2 minutes, then discard the swab. Step 5. Submerge the test strip into the tube for 10 to 15 seconds. Do not submerge the test strip beyond the max mark line or this will render the test invalid. Remove the test strip. Place it horizontally on a flat surface and read the result after 5 minutes. Do not read the result after more than 10 minutes have passed. Instructions for testing liquid samples. Step 1. Place the test tube into the included test tube holder. Pour the entire bottle of buffer solution into the test tube. Step 2. Add 1 drop of the liquid sample to the filled test tube. Step 3. Dip the swab handle in the filled tube and stir for 1 to 2 minutes. Then discard the swab. Step 4. Submerge the test strip into the tube for 10 to 15 seconds. Do not submerge the test strip beyond the max mark line or this will render the test invalid. Remove the test strip, place it horizontally on a flat surface, and read the result after 5 minutes. Do not read the result after more than 10 minutes have passed. Interpretation of test results. Positive. Only 1 colored line appears in the test strip in the control region C. Negative. 2 colored lines appear in the test strip, 1 line in the control region C and 1 line in the test region T. Invalid. No lines appear or the control line fails to appear. The Rapid Response Fentanyl Test Kit provides a practical solution for testing surfaces, powders, solids, and liquids for fentanyl and various other fentanyl analogs. Given the significantly high potency of fentanyl, the test kit can prove incredibly useful for those who may unknowingly come into contact with or consume fentanyl. The test delivers results within 5 minutes and has an incredibly high degree of accuracy, making it the best fentanyl test kit on the market.
Just because a fentanyl test used on a substance or substance residue presents as negative does not mean there is not a possibility that there may be fentanyl in it. As stated previously, the BTNX tests are approximately 98% effective in detecting fentanyl, but there still is that 2% or so where it might not be detected. There are also some fentanyl analogs that might not be detected by the BTNX fentanyl test strips. Educating the client on the importance of having Narcan or naloxone present and having another individual present as well if a substance are being used is crucial. Continuing to educate the client on getting regular testing for HIV and important medical care as well, using clean syringes and access to syringe service programs near where they reside can all help decrease negative outcomes caused by drug use. Practices such as washing hands, using alcohol on the skin prior to injection, using sterile water when mixing a substance, and rotating injection sites are also harm reduction practices that can be taught to clients. In 2019, a company called Signify Analytics stated that an educated consumer is an empowered consumer, and you can make an informed decision. When a substance that is tested reads positive on a fentanyl test strip after testing the substance or residue, there are options as to what to do next. The individual can dispose of the contaminated drug or can use a test shot or inject only a small amount of the substance at a time. It is important to educate the client in the use of Narcan naloxone and to recommend that the individual ingest the drug with another person present in the event an overdose occurs. Supplying the client with information on local support centers and overdose prevention facilities, as well as in the national hotlines such as Substance Abuse and Mental Health Services Administration National Helpline, which can be reached at 1-800-622-HELP or 4357. It's a free confidential treatment referral program and offers information services for those experiencing substance abuse or family members facing substance use disorders, as well as educating the clients on the importance of calling 911 if the situation becomes critical. The Good Samaritan Law in Massachusetts currently protects any individual from charges for possession of illegal substance if they contact 911 in the event of a drug overdose. The Acts of 2018 in Massachusetts expanded access to Narcan, naloxone, by putting in place standing orders into law. The law mandates that all retail pharmacies in Massachusetts must have Narcan naloxone in stock, and under that standing order, anyone can have access to Narcan naloxone without requiring an individual prescription from a provider. MassHealth, Medicaid, Medicare covers the cost of Narcan naloxone, as well as many other insurance companies in Massachusetts. Local pharmacies such as Walgreens and CVS will allow an individual to go to the pharmacy counter and request a dose of Narcan naloxone without question. Naloxone Narcan is an opiate antagonist, which means it attaches to the receptors in the brain and blocks opiates from attaching. When this occurs, it rapidly reverses an opioid overdose and restores respirations in an individual. In some cases, multiple doses of Narcan naloxone is needed depending on the amount of opiates in an individual's system. Educating the client to have multiple doses of Narcan naloxone available is also important. There are different types of Narcan that is currently dispensed. Most commonly, clients will see the one-step nasal administration, the two-step intranasal administration that requires pieces to be screwed together, or the auto-injection that is administered into the thigh of an individual and has commands that come through a speaker to instruct the person how to use it. Further education on how to use Narcan can be provided by the pharmacist, an overdose education and Narcan distribution location, or easily accessed online. Thank you very much for watching our presentation.